for Oak Bay, Gordon Head.
Thank you, Honourable Speaker. Honourable Speaker, Island Sexual Health Society provides essential primary and public services to the Lower Island, with over 26,000 patient visits each year. It fills a significant gap around basic healthcare needs in a cost-effective manner. My riding has both the Camosun College and the University of Victoria, with thousands and thousands of students who do not have GPs or access to GPs who require these services. The Island Sexual Health Society is systemically underfunded by our public health system, needing more than a third of their budget, in fact 36.4% if you wish to know, of their operational budget from non-governmental sources. As a consequence, they're struggling to stay open. In fact, you might say they're victims of their own success. My question, Madam Speaker, is through you to the Health Minister. Will the Minister make a commitment to support Island Sexual Health in continuing to provide these essential services?
Minister of Health.
Thank you very much, Madam Speaker, and thank you to the member for Oak Bay Gordon Head for the question. Island Sexual Health is a nonprofit organization that does provide excellent service to people in Victoria area. They have a mixed funding model, Madam Speaker. They provide services on a fee-for-service basis, and that continues so that health services are available through that model. They also provide some public health services through funding from Island Health, funding that has continued to increase over time. Now, I understand, Madam Speaker, that Island Health moved into larger facilities, and the higher costs associated with those larger facilities have outpaced their revenue in terms of the MSP fee-for-service model. So I know that Vancouver Island Health Association Authority, Madam Speaker, is working with Island Sexual Health, and we will be involved in those discussions to look at ways of supporting this organization to maintain the valuable services that they do provide, but also to maintain and stay within the budget that they have for those services.
Thank you, Minister. Oak Bay, Gordon Head on a supplemental.
Thank you, Honourable Speaker, and thank you through you to the Minister for the very thoughtful response to that question. I would like to add that just this week, Honourable Speaker, the Board of Island Sexual Health met and agreed to cut their budget for this next fiscal year by $140,000, and they also made some structural changes by going to a walk-in model to increase client numbers and decrease administrative costs. But as the Minister noted, they still need long-term commitment of $235,000 per year to offset tenancy costs. This is the barrier to their continued success. So again, through you, Honourable Speaker, to the Minister, would the Minister be able to agree again to work with Island Sexual Health in order to solve the crisis, the short-term crisis that they face in terms of meeting their monthly tenancy costs? Frankly, the services they offer to Vancouver Island and Southern Vancouver Island are simply too important for them not to remain solvent. Thank you, Honourable Speaker.
Minister of Health.
Thank you, Madam Speaker. Thank you very much, Madam Speaker. And again, I want to acknowledge the very good work that Island Sexual Health provides to residents in the Victoria area, particularly the university population. The member from Oak Bay and I share family members who attend the university and know that these services are very valuable. However, Madam Speaker, whether it's a nonprofit organization or whether it's a private corporation providing publicly funded health care, it is important that they pay attention to the funding model and the revenue that comes in and the expenditures. And in this situation, this organization decided to move into space that perhaps outpace their ability to match with revenue. But we will work with them. We will work with Vancouver Island Health Authority to look and see if there are ways of supporting the organization while making sure that they stay within their budget.
Thank you.